Good evening, future Chamberlain nurses, esteemed faculty and staff, and of course, families and friends who are joining us this evening for this very special event. My name is Dr. Samindia Clark, and I'm the campus president for Chamberlain University's Chicago campus. Today, we are gathered in a celebration that denotes a milestone in the academic journey to become an extraordinary nurse. This evening, we are about to embark upon a transition in your academic journey. This transitional ceremony, created as the White Coat Ceremony, originated at Columbia University's College of Physicians and Surgeons in 1993. The first White Coat Ceremony marked a transition from the academic foundation of the College of Physicians and Surgeons to the residency and clinical practice in patient care. Over the past 25 years, the ceremony was expanded to other health professions to include physician's assistants, pharmacists, and students in dental practice. In 2015, colleges of nursing across the United States began to conduct white coat ceremonies to emulate those of physicians. While we appreciate the symbolism and rite of passage that is supported by the event, the leaders of Chamberlain University have identified a need to support a unique ceremony that is dedicated to nursing and the transition to patient care for our future nurses. To share a bit of history, in the planning phase of the ceremony for our future Chamberlain nurses, there was much discussion of what the ceremony would look like, and if it was about nurses, extraordinary nurses, and their transition to practice. Despite the many ideas that circulated from leaders, faculty, staff, and students, there are some common themes that surfaced. The profession of nursing deserves an event focused on trust, honor, humanity, respect for our patients, their families, and their cultural and spiritual needs, and a recognition that every interaction in the clinical setting will set the foundation as an important step in becoming an extraordinary nurse, a Chamberlain nurse. And so the ceremony was launched. Soon you will enter into the profession of nursing and caring for patients and their families in need of your professionalism and knowledge. Today, we welcome you into our profession as a nursing student who has the foundational knowledge to practice the science of nursing and the application phase of skills. Today, you have reached a milestone. Today, we congratulate you and celebrate you as the next time you cross the stage will be on your pinning and graduation days. Enjoy the evening and thank you for allowing us to travel this academic journey with you. Well done.
Hello, fundamental students. My name is Aisha McGee, and I am in my second year here at Chamberlain. And I wanted to take some time out of my day to come and congratulate you on moving forward in your nursing journey. I know that you're on your way to clinicals, whether that be virtual or in person. I wanted to just encourage you and offer my supportive words. So, as you're transitioning into patient care, I believe the best thing you can do is be confident in the information that you've learned from your previous courses, as well as being confident, always taking each opportunity that your professors or your clinical instructors offer you to step up. I would, since we don't know how much time we will be in this virtual world or back in the clinical setting, you have to take every opportunity as it comes. I want to again congratulate you all because you are rock stars and have been doing this online for a very long time, and we can't wait to get you in person and get your hands on actual patients because we know you all will be amazing. All right, enjoy. Bye.
Hello, my name is Dr. Demetrius Hogan. I'm an assistant professor here at Chamberlain University Chicago campus. And I'm so very honored and excited to have been asked to speak to you on this Your Transition of Care Ceremony Day. As I think back over my own nursing career, I started off as a CNA at the age of 19, not even really sure what I was about to get into. I was excited and nervous, and I remember that first CNA class that I took and learning how to take a temperature. Right. And it was a really big deal. And I would come home and I told my parents, oh, I need to practice. I need thermometers. And so I went to the Walgreens and bought thermometers and just practiced taking temperatures over and over again. It was a really big deal. And then when it came to taking blood pressures, every family holiday dinner, I was taking somebody's blood pressure because I wanted to practice, because I wanted to be comfortable and I wanted to learn how to take care of people. So I always would spend time practicing anytime I could. So as you prepare to go into your first clinical setting, I know that during, this 2020 pandemic, it doesn't seem like it's a real clinical experience, but I want you to take it for what it is. Take this step as an important step because you are continuing your journey into nursing school. This is now signaling that you have, learned how to do an assessment. You learned how to take vital signs. You've learned what an abnormal assessment looks like. You've learned, how to change dressing, how to insert Foleys, how to give a bath, how to make a bed. Things that some people take for granted, you have now learned how to do and can do for other people. And so remember that though this is not a normal time for any of us, the job that you guys are embarking on, this journey into nursing school, is a lifelong decision. And it is a career path that will take you to many, many wonderful heights. Nursing can be as good to you as you are to it. Okay, so congratulations on this beautiful milestone, on this big step into your nursing careers. And as you go through, always remember why you went to nursing school, why you're taking this journey. Even when you've been a nurse for 5, 10, 20 years, always remember that why, that spark that made you want to go to nursing school. And it'll continue, and you'll never ever forget it. I've never forgotten what my why was. All these years later, I've been practicing for over 25 years, and I've always known that I've wanted to help people. So that was my why. So always remember it. Keep it with you. Congratulations. I look forward to meeting you all and then joining you all in my profession. Thank you.
on the journey from the classroom to clinical. Students, please join me as we read the Transition to Care Pledge. As I transition to patient care, I pledge to use all I've learned to bring healing and comfort, to trust in myself and learn from those who are here to guide me, to honor the humanity of my patients and their families, to respect their culture and spiritual needs, and to care for my peers as I care for my patients. I will treat every day, every interaction, as an important step on my journey toward becoming an extraordinary nurse. Thank you.
In closing, we want to extend a special note of thanks to all of you who participated in the planning of this virtual event. We would also like to thank our students, their families, and friends who have joined us this evening. And last but not least, we would like to thank you, our students, who have worked to diligently earn this rite of passage in caring for our patients, their families, and the community. Best of luck to you in all that you do.